For some time, we've been hearing about the deadly MERS virus, or Middle East Respiratory Syndrome. It's a flu-like disease that kills 30% of those who become infected. After the World Health Organization's Director General declared the virus a threat to the entire world last year, health officials have reminded us over and over that it was just a matter of time before the disease spread from the Middle East to the U.S. Last week, the U.S. saw its first confirmed infection in an Indiana healthcare worker. So how worried should Americans be? U.S. health officials are actually downplaying the risk. One CDC director said the first U.S. case, quote, represents a very low risk to the general public. Another added, in this interconnected world we live in, we expected MERS to make its way to the United States. We've been preparing since 2012 for this possibility. The agency hasn't even issued a travel advisory for the hardest hit areas. That's because it turns out the virus's main source is the one-hump camel, which explains why the outbreak started in the Middle East and transmission person to person is rare.
There has not been a clear case of person-to-person transmission outside of the healthcare setting yet. So I think we need to keep this in perspective.
There have been cases of the virus spreading among humans, but it generally requires close contact. Health officials say you'd need prolonged exposure to an infected person to catch the disease yourself. The Indiana patient is also reportedly doing well and is expected to be discharged soon. No one who came in contact with him has reported symptoms yet. But a writer for Time says the U.S. got lucky and that new viruses are emerging all the time that might not be as slow spreading as MERS. Today, there's almost no spot on the planet so remote that someone couldn't make it to a heavily populated city like New York or Hong Kong in less than 24 hours, potentially carrying a new infectious disease with them. The World Health Organization does have a few pointers if you plan on traveling to the affected regions. Don't get too close to people with respiratory infections, wash your hands often, be careful what you eat, and avoid contact with most animals. And obviously that includes camels. For News, I'm Zach Toombs.